Your rheumatologist just said 4 words that made your heart sink. It's time for Humira. And you probably have seen the commercials, that long list of warnings, the cancer, the tuberculosis, the heart failure. And then you saw the price, $9,000 per month, $100,000 a year. And you are sitting there wondering one thing: is this drug going to save my joints, destroy my body, or bankrupt my family? I'm Dr. Diana Girnita, a board-certified rheumatologist with a PhD in immunology, and I have prescribed Humira to thousands of patients. But today, I'm going to walk you through this drug the exact way I do it for my own patients, what it does, who should never take it, and what are the risks that nobody explains to you in that rushed 12 minutes appointment. And stay with me until the end, because I'm going to show you a cost-saving secret that can cut your Humira bill up to 80%. And most doctors will never tell you that this exists. So let's begin. What Humira actually is. Now pay attention to this, because most patients take Humira for years and they never understand how it actually works. Humira is also called adalimumab. It is a TNF-alpha inhibitor. And TNF is a protein that your own immune system cells will make. In autoimmune diseases, your body makes far too much of it, and that excess of TNF will drive the inflammation in your joints, in your skin, and in your gut. Humira is a monoclonal antibody, and in plain English, it locks down the TNF and it will neutralize it. It does not shut down your entire immune system. It will target one specific inflammatory pathway. And for more than 30 years, it has been one of the most prescribed biologics in the world. For rheumatoid arthritis, for psoriatic arthritis, for ankylosing spondylitis, for Crohn's, and many more. And for many patients, it changed everything. The joint erosions stop, the inflammation comes down, and the quality of their lives comes back. But before you inject a single dose, there is a set of tests that you absolutely must have, because if you skip them, then Humira can put you in the hospital. Number 2, the test you must have first. This is critical, and if your doctor will skip this test, this is a real red flag. Before you ever start Humira, your doctor should order tuberculosis screening, which is a PPD or quantiferon gold, because Humira can reactivate latent TB. It should order hepatitis B and C screening, because Humira can reactivate these viruses. And it should also order a blood count, metabolic panel, and HIV screening if you are at high risk. If you're being started on Humira without these tests, just be careful, because this is a warning sign. Now, how do you take it? Humira is an injection, it's not a pill. You give it to yourself under the skin, usually every other week or every 2 weeks, as a 40 milligrams pre-filled pen. Here is my advice for my own patients. You should rotate your injection site. You should do it in the thigh, then in the abdomen, then again in the thigh, then again in the abdomen. And you should also let the pen sit down at the room temperature for 15 to 30 minutes before you inject, because that will sting far less. And you should never inject into a skin that is bruised, red, or has a scar. Okay, now you understand that Humira is powerful and you've done it safely and correctly. But does it really work? And here it is what I see in my clinic. Number 3, how well it actually works. Here it is what most patients don't realize about Humira. In my practice, most patients will improve between 4 and 12 weeks. The pain will start dropping. The swelling will go down. The morning stiffness will become shorter, and then the function comes back. But here it is the part that matters the most. Humira doesn't just treat your symptoms. It actually slows down and can even stop the actual damage, the joint damage that happens in rheumatoid arthritis, which otherwise will happen over time. And this is actually huge, because you're not just feeling better, you are actually protecting your whole future. The joints that you save this year are the joints that you are still going to use in the next 10 years. And now let's move on and let's talk honestly about the risk of taking Humira, because there are real ones and you deserve the truth, not a sales pitch. Number 4, the side effects. I'm going to be honest with you the same way that I am with my own patients. Number 1, infections. This is the most common risk. Usually the infections are mild, like a sinus infection. Serious infections, the one that will put you in the hospital, are very uncommon, around 4 to 5%. But the risk will go up if Humira is combined with methotrexate or with steroids. You should watch for tuberculosis, for shingles, for hepatitis B reactivation, and for severe pneumonia. My advice is that if you ever develop fever, severe cough, if you have persistent diarrhea, then you should stop the medication and you should call your rheumatologist immediately. Number 2, vaccines. And this is very important because there is a lot of hype and a lot of discussions about vaccines. But before I start Humira, I tell my patients that they should get up to date on flu, pneumococcal, COVID vaccine, shingle vaccine, and hepatitis B if they're not immunized before. Because once you are on Humira, inactivated vaccines are still safe, but you should avoid any of the live vaccines like MMR, like yellow fever, actually the old live shingle vaccine. Number 3, cancers. And this is an honest answer because there is a lot of fear about cancer. There is a small increase in the risk of lymphoma and non-melanoma skin cancers with TNF-alpha inhibitors, but the risk is low, but it is real. But my advice remains to see a dermatologist once a year that will do a full skin check. And if you ever develop fever, night sweats, and if you develop enlarged lymph nodes, then you should call your doctor again immediately. Number 4, let's talk about the heart. Rarely, TNF inhibitors can cause or can worsen heart failure. So if you have a history of a heart disease, you should tell your rheumatologist before you start Humira, because he might choose to order an echocardiogram, an image to your heart first. And now let's talk about pregnancy, because this is one of the questions that many of my female patients will ask. Humira appears to be relatively safe for people that are remaining pregnant. And many studies have shown that Humira did not increase the risk of birth defects, and it could be continued up to 32 weeks of pregnancy, but then it needs to stop. It is also considered to be safe during breastfeeding because just a small amount will pass through the breast milk and will affect the baby. Now, one quick rule. Humira is safe to combine with other drugs like methotrexate, leflunomide, sulfasalazine, or hydroxychloroquine, but it should never be combined with another biologic because that will increase dramatically the risk to develop an infection. But here is the question that I get more than any other. What happens when Humira stops working? Number 5. In my practice, I see this all the time. And here it is, the real reason behind it. Over time, some patients, not all, will develop anti-drug antibodies because your immune system will build up antibodies that will neutralize the effect of the drug, of Humira, and the drug will stop working. And this is why my approach is a little bit different, because I always try to combine Humira with a little bit of methotrexate, because methotrexate will lower the chance of those antibodies to be formed. So if Humira stops working, what are the other options? You can switch to another TNF-alpha inhibitor like Enbrel or Cimzia. You can switch to a different class of medication like IL-6 inhibitors like Actemra or a JAK inhibitor. But here it is what's coming. There is a new TNF blocker called ralizumab, and this is a nanobody, which is a drug that is 4 times smaller than Humira, and these drugs actually can work even better or after Humira fails. It was already approved in Japan, and unfortunately it is not still available in the United States or Europe, but I assume that it's gonna come. But I know the therapy with TNF-alpha inhibitors is trending in that direction. Now we got to the part that I promised promised you in the beginning of this video, the cost secret that your insurance company does not want you to know. Number 6, the biosimilar secret. Please pay attention to this because what I'm going to tell you could save you thousands of dollars every year. Humira remains one of the most expensive medication on earth, with a list price around $84,000 a year. And for 2 decades, actually 3 decades, patents protected it, and there were no alternatives. But then in 2023, those patents expired and we had biosimilars arrived on the market. Quick question, what is a biosimilar? Now, I want you to think of it as a generic version of a biologic. It is not literally identical because biologics are far complex for that, but it is so close in the structure and the function that the FDA will consider it a clinically equivalent, which means that it has the same effectiveness, it has the same safety, and it will act through the same TNF-alpha blockade. And you're probably going to hear names like Humira, Amgevita, Hiromos, Hadlima, and many others. And they have been used for many years in Europe, and the science supports them. So why isn't saving everyone's money? Here it is what most patients do not realize. The list price of a biosimilar can be dramatically lower, sometimes as low as $1,000 per month versus Humira, which is $8,000 and plus. But your insurance company will often charge you almost the same copay either way. Why? Because insurance, when they negotiate these complex rebates with the original manufacturer and with the pharmacy benefit managers, they will end up profiting from the system that they created. And those savings that existed, they will disappear into the middle of the system before they reach to you. And this is important because here at Rheumatologist on Call, we actually identify pharmacies that will offer biosimilars at dramatically lower cash prices. And most rheumatologists in the country don't know that these options exist. But my advice is that if you are on Humira and you have to pay out of pocket hundreds of dollars or thousands of dollars every month, you are almost certainly overpaying. So ask about your options, and if you don't know them, come talk to us. Now let me tell you a story of one of my patients. This 42-year-old gentleman came to me with severe rheumatoid arthritis. He actually failed methotrexate, sulfasalazine, and he was sitting on 20 milligrams of prednisone every day just to function. And unfortunately, he could barely button his shirt, and his Humira copay was about $2,000 per month, which his family simply could not afford. We did what we do for all patients. The pre-Humira workup, the TB was negative, the hepatitis B and C were negative, and then I switched him from Humira to a biosimilar through a pharmacy program that actually brought his cost down to less than $600 per month. And then 6 weeks later, his morning stiffness dropped from 3 hours to 20 minutes. And then in 12 weeks, he was off prednisone completely. And in 1 year, his x-ray showed us that he had no joint damage at all. And he told me, I got my life back and now I can afford the medication. But here it is, the most important thing that I want you to take from this video. Yes, Humira can be a life-changing drug, but only when it's prescribed safely, when it's monitored properly, and when it's priced honestly to be able to afford it. Because many patients do this wrong. They accept the prescription, they pay whatever the insurance will charge them, and they will never learn that there are other alternatives that actually will cost a fraction of that price. And we all know that the traditional medical system is broken. A 12-minute appointment, a prescription that is handed to you, no screening conversation, no discussions about biosimilars, no path to afford it. That is exactly what I built Rheumatologist on Call. Because when you work with us, you see a board-certified rheumatologist in just a few days, not in many months. We offer telehealth across many US states, and we are actually expanding. And we don't need any referral to see you. You have a full 1 hour in the first visit, And at that point, we review everything, your screenings, your vaccines, the dose of medication, and we even offer you the cost-saving options for many medications. We help patients get into remission, and we help patients stay into remission. And if you want to book a consultation, the link is in the description of this video. Now, understanding Humira and biosimilars is just a step one. And if you want to learn more about new breakthrough treatments that are coming in autoimmune diseases, you should check this video because you will be blown away.